may want to get rid of all the leftover Halloween candy in your home after hearing more about the impact that researchers say sugar has on children and adults' brains and how it triggers diseases like diabetes, depression, and Alzheimer. With more on this is local neurologist Dr. Chad Domingue with the Avila Physician Network. Thank you so much for joining us.
Good afternoon. I raided my boy's stash from Halloween to do this segment. It's incredible what these kids get for Halloween.
Yeah, and it's so timely right now. So basically, what does this research show that you have too much sugar, the impact it's having on your brain as you continue to consume this as an adult, as a child, and why does it lead to such serious health problems?
This conversation about sugar really parallels neurology. And what I'm trying to make is everybody knows about obesity and heart issues and so forth. But what they don't think about is how some of these same chemicals affect our brain. Every cell of our body needs sugar, glucose. And as you know, there's many forms. There's raw sugar, honey, and then there's all these processed sugars, fructose, and so forth. What most people don't realize is 60% of our overall sugar utilization is our brain. And so when you start introducing high levels of sugar, artificial sweeteners, and so forth, there are neurochemical effects to the brain itself. It inhibits its ability to talk to each other, so it can't make the transmitters like it should. It causes parts of the brain to function abnormally. But long story short, we think of this stuff in terms of our weight, our heart, but we don't think of this damage we're causing to our brain.
And what would you say all of the candies have sugar or fructose in there? Are there some that tend to be really high up there when you see a correlation between certain diseases if you consume too many of them?
Sure, yeah, and we'll talk about that. But one more thing to the question you were asking earlier, what exactly does it do to the brain? There's a chemical called brain-derived neurotrophic factor. It decreases. And this is the oh wow moment, Liz. If you take a functional MRI, which is what we look at to see how the brain is firing, and you give someone cigarettes, alcohol, cocaine, or sugar, you cannot tell the difference in the brain. Most people don't think about sugar as a drug, but in the pure medical sense of it, it certainly is. I have some of the big offenders, Nerds, one of my favorites, about 17 grams of sugar, depending on the size, Twizzlers, fruit roll-ups, these lollipops, all of these things have high levels. The average American consumes 34 tablespoons of sugar a day. The World Health Organization says we shouldn't take more than 25 grams a day. We're averaging 84 grams of sugar a day. So, wow. Average American. I'm sure in Louisiana we probably take a little bit more, but those numbers are pretty staggering when you say them out loud.
Okay, so with you repeating that number again, what people should be having, what they end up taking in, tell me some of the diseases those lead to.
Yeah, this is the oh wow moment, I think, for a lot of our viewers. Again, they know the heart, they know the weight. People with diabetes, they have high sugars, right? We know that they have a twofold higher incidence of dementia because of those higher sugars, all right? When a lot of people try to get away from sugars, they do these artificial sweeteners, right? So Splenda, aspartame, equal, all this stuff. Here's the problem. These substances are neurotoxic. So Splenda in a rat model shows atrophy or damage to the hippocampus, which is the memory portion of the cell. People that drink one diet soft drink a day have a threefold higher risk of stroke and a threefold higher risk of dementia. So here we are doing these diet drinks to lose weight and to quote unquote be healthy, but we're robbing Peter, our brain, to pay Paul, our heart and our body. It's really very interesting when you look at the whole picture.
Well, it's really eye-opening, especially when you think of all the candy you have in your home. So thank you for pointing out those things. People may think a little bit more when they decide to really start binging on all of that candy. I appreciate you sharing that important details for us.
Absolutely, and I'm throwing this stuff away, so if anyone wants it, just come by my home.
Thank you. Thanks, Dr. Chad.
All right, let's.